Good morning, everyone, and thank you very much for tuning in this morning to our Women with Heart Online session today. Natalie, I'll get you to advance to the next slide, please. We're very excited for our presentation today, and the title of today's presentation is Bone Health, Maintaining Healthy Bones for Life. Okay, so without further ado, I'm going to hand it over to Dr. Rajni Najawan to introduce today's speaker.
Hello, good morning, everybody. Happy Tuesday. I see some familiar participants on the list today, so welcome back. Today's presentation is all about bone health, as Lisa has just introduced us. So Dr. Daly is going to be the main presenter. Dr. Daly finished her degree in medicine from the Queen's University. So she is already a doctor, but getting trained into her subspecialty of the physical medicine and rehabilitation. So she is here with us at the cardiac rehab. We are so fortunate to have her. And we were just talking about the next topic, and Dr. Daly decided that she's going to do the presentation. So I'm very pleased that she decided voluntarily. So thank you, Dr. Daly. It's all yours. We can start whenever you're ready.
Thanks, Dr. Najwan. I'm just going to go to the next slide. Okay, good morning, everyone. Thanks so much for joining us today. And I'm really excited to be here with you to talk a little bit more about bone health and what that means and what it can mean for you and how to maintain healthy bones so you can keep doing all of the things that you enjoy doing. As Dr. Najwan said, my name's Dr. Daly. My first name's Natalie, and I'm a physiatry resident, or a physical medicine and rehabilitation resident. I'm training to become a doctor specialized in rehabilitation. So bone health is something that's very important in our specialty. So let's start. Today I have a few objectives for us to go over. First of all, I want to review the importance of bone health and why it matters to us. I want to define what osteoporosis is and give you a little bit of information about how it may affect you and what the different ways to diagnose it are. Additionally, I want to talk about how we can maintain healthy bones, and then I want to talk about the treatment for osteoporosis. So let's start off. What are bones? We all have bones, but what are they? Well, bones are a living and growing tissue that provides structure for our bodies. They're where muscles attach. They protect our organs, like our skull protects our brain. Our rib cage protects our heart and lungs. And then our pelvic organs are protected by our pelvic bones. They're also a storage site for minerals. Especially, the biggest one we think of is calcium, which helps to make our bones hard. They're also a site for making blood cells, and I'll touch on that a little more in a minute. As you can see from this diagram here, we have different types of bones in our body. We have big, long bones, which are like our femur in our leg, other bones in our arms and legs. And then we have other types of bones, like short bones or vertebral bones, which are called irregular bones, and they make up our spine. The two that I'd like you to try to remember a little bit are bones like long bones and irregular. You don't have to worry about the names. Just know that there's different types of bones in our body, and we'll be talking about those as we go through this presentation. So what are bones made out of? Well, there's kind of three main layers in bones. There's an outer layer, which is really hard and dense, and it's called cortical or compact bone. Then there's an inside of the bone, which is the cancellous bone, which is spongy. If you think of a kitchen sponge or a sponge that you do crafts with, it has all these tiny little holes. And so cancellous bone similarly has all these little holes in it, which is where some cells live. And then in the very inner part of the bone is the bone marrow. Now, what is bone marrow? Bone marrow is where some of our blood cells are made. You might have heard of bone marrow in other talks, but that can be where that is where our blood cells are made. And so we won't touch on that very much anymore, but the two main things I'd like you to remember are this spongy bone and the cortical compact bone. So what else is bone made of? How is it formed? Well, there's 4 main types of cells. You don't need to remember the names of the cells, just kind of what they do. The 2 most important parts are the osteoblasts, which are the bone building cells. So they help to make our bones hard and to really build them bigger as we age. Then there's the bone remodeling cells, or the bone breaking down cells. They help to shape the bone and constantly renew it. So they break it down. Similarly to if you're building a new condo building in downtown Toronto, but out of a kind of an older building, there's constantly remodeling going on. You're taking down certain parts, you're putting up other parts. And so there's this constant balance between the bone building and the bone remodeling cells. Then you can also see in this picture the osteocytes, which are bone structural cells, and osteogenic cells, which are the precursor cells. So they become the other types of bone cells. Okay, so what happens to bones as we age? Well, as we age, you can see our age is down on the bottom of this graph, and the total bone mass, so how much bone we have, is up on the side. As we age, when we go from just a baby to all the way to around 20 to 30 years of age, our bone mass increases. We hit a peak bone mass of anywhere from 20 to 30 years of age, depending on whether we're male or female and some genetic factors. Then, as you can see, it kind of plateaus for a few years, and then especially in women, right around the age of 40 to 50, when menopause is beginning and estrogen is decreasing, we see a big dip in our bone mass. Just like in cardiovascular disease, estrogen can play a large role in women's health. And I'm sure that you've heard about this in some of your other classes you've been able to take, that when women start to have menopause, their cardiovascular health can change and can get worse. It's similar for bone health. Women need that estrogen to help make their bones strong. So when you enter menopause, the bone does start to become less dense and they have less bone mass. This is a little different than in males. So if there happens to be any men watching, the bone mass takes a gradual decline. It doesn't have the dip that the women's bone does. And that's because men don't have a similar physiologic function like menopause. They don't go through those big hormonal changes, but women do. Okay, so why is bone health important? Why are we talking about this today? Well, bone health affects a lot of people in Canada, all over the world, but we're in Canada specifically today. So let's talk about our statistics. 1 in 3 women and 1 in 5 men will suffer from an osteoporotic fracture during their lifetime. That's a lot. That's 1 in 3 out of the people for women and 1 in 5 for men. Also, 2 million Canadians have been diagnosed with osteoporosis. Again, that's quite a widespread disease compared to some of the other diseases that we work with. Additionally, osteoporosis, as we'll talk about a little bit later, can contribute significantly to fractures. Fractures are when a bone breaks. And if our bones are not as strong and not as dense, they can be more prone to breaking. And so Osteoporosis Canada has done some statistics and seen that over 80% of all fractures in people above the age of 50 can be attributed to osteoporosis or low bone density. Okay, let's move on. So let's focus on osteoporosis. I've said it a lot, but what is it actually? Well, osteoporosis literally means osteo, which means bone, and porosis, which means porous. So bone that is porous. Now, if you think of it, if you go back to the analogy that I had for you about that kitchen sponge or a sponge that you do crafts with, or clean things with, if you can picture it, it's nice and dense, but as you use it more and more, it becomes, there gets to be holes in it that get bigger and bigger. And it's similar with bone, except instead of it being use that makes the holes bigger, it's actually the cells. And remember how we talked about our bone building cells and our bone remodeling cells. Well, often that process becomes a little bit unbalanced. And that's why I have the scale for you, because usually our bone building and our bone remodeling cells are in a balance. And so we have a stable bone mass. But depending on our different risk factors, which we'll get into in a minute, sometimes the scale gets a little bit tipped to one side. And often as we age, it gets tipped to the more bone breaking down and less bone formation side, which means that our bone goes from looking like this nice, dense bone where you can't see very much black to this bottom square here where you can see it's a lot thinner. There's a lot more black showing through, and it's just there's a lot more holes and pores in that bone. Okay, so remember, osteoporosis, bone that is porous. Okay, so what are the signs and symptoms of osteoporosis? How do you know if you have it? Well, often osteoporosis is what we would term a silent disease, meaning you don't actually know that you have it until you have one of its consequences. There are a few symptoms and signs that we can look for to help tip us off that maybe that's what's happening though. One of those is height loss. So if you lose more than 6 centimeters, which is actually quite a lot from your peak height. So if we look at this skeleton here, we can see at age 55, he was this height, and then he decreased and decreased again. Probably at this point, the skeleton has really realized that they've had a big decrease of their height. And so we need to see more than 6 centimeters, or if it's measured by a doctor, it can be a little bit less than that. Additionally, a stooped posture. So again, if we look at this skeleton, we can see the spine, which is nice and straight. It's slowly starting to curve here, and then it really curves forward on the furthest to the right skeleton. Sometimes people will notice that their belly has become a little bit bigger, even though they haven't gained weight. So their belly getting bigger in combination with further curving of the spine can be a tip-off to osteoporosis. And it's not that they've actually gained weight, it's more that their spine has changed shape because of a possible fracture in their spine. And we'll talk about that a little later. The other sign or symptom of osteoporosis is actually a fragility fracture. Now, a fracture is when your bone breaks. Some of you may have already had fractures as a kid. If you fell out of a tree or you fell off the monkey bars, lots of people have had wrist fractures or collarbone fractures. As we age, more common fractures are ankle fractures. Many people have those when they've twisted their ankle or missed a few steps walking downstairs. Or hip fractures we hear about very commonly, especially with osteoporosis. Other fractures are pelvic fractures in our pelvic bones, and vertebral fractures or spine fractures. Often those are fractures where the vertebral body kind of squishes from forces. Now, a fragility fracture is a little different than when you fell off the monkey bars when you were 8. A fragility fracture means that you've fallen or had a broken bone from something that wouldn't usually cause a fracture. Now, what would that be? Well, tripping and falling, someone that's young and healthy and has good bones wouldn't usually cause a fracture. But in people with osteoporosis, it can cause a fracture because the bones are more brittle and weaker. Other things that I've commonly heard are if someone has slipped in the bathtub and cracked some ribs, or if they've just sat down too hard on a hard surface and then gotten back pain. Sometimes that can be a sign of a vertebral compression fracture. What are the risk factors for osteoporosis? So who might be at risk? I've already alluded to this many times, but women are more prone to osteoporosis because of the postmenopausal changes and the decreases of estrogen. Now, there's some things that we can't change. You've learned those as non-modifiable risk factors in some of the other classes that you've taken. So these are the non-modifiable risk factors are female sex, older adults, so postmenopausal women, as we've talked about, and men over the age of 65. Because if you remember that graph, even though men don't have that dip, they still do have a steady decline. Also a family history of fracture, especially a hip fracture, if they're of Asian or Caucasian descent, and early menopause, which means menopause earlier than the age of 45. What about some risk factors that we can change? So modifiable risk factors. Well, things like smoking and alcohol intake, and we'll talk about those two specifically in a minute. Also poor nutrition, especially during that bone building phase in the younger years. Low activity levels, certain medications such as steroids or certain cancer medications, and also certain medical conditions, specifically things that raise the level of inflammation in the body, like rheumatoid arthritis, or some things that make it hard for the body to absorb nutrition, like inflammatory bowel disease or Crohn's. Now, smoking, I said we'd talk about this one specifically. Smoking, as you know, can be very hard on your heart health, but it can also be hard on your bones. And that's for a few different reasons. First of all, smoking impedes those bone building cells, the osteoblasts. Also, smoking increases stress hormones, which can lead to bone breakdown through the bone remodeling cells. So it helps to get those jump started. Also, smoking can damage some of the blood vessels that lead to the bones, which can cause bone damage. And so it's really important to try to cut back smoking or to stop smoking or to never start if that's possible. Additionally, if you are healing from a fracture, it's important to not smoke because that can be really, really detrimental in terms of bone healing. Now, what about alcohol intake? Well, as you've learned in your cardiovascular rehab courses, there's specific maximum recommendations in terms of alcohol intake. Osteoporosis Canada, which is the main osteoporosis body in Canada to help set guidelines, takes those a little bit further and says that you shouldn't have any more than 2 drinks at one time, specifically for bone health. In women, shouldn't on a weekly basis, you shouldn't drink any more than 9 drinks per week. And that is really a maximum. So if you can drink even less than that, that will be better for both your cardiovascular and your bone health. Now, what is a standard drink? Well, often we actually don't have a great gauge of what that is. A standard drink is 12 ounces of beer. That's a lot less than the standard big pint glass that you get at your local restaurant. Additionally, it's 5 ounces of wine, or again, 12 ounces of a cider or cooler. So just be mindful of your serving sizes, and when you go to restaurants or when you're eating or drinking at home, it's important to remember the different serving sizes. Okay, so we've talked about the risk factors for osteoporosis and what might make someone a little higher risk. But how is it diagnosed? If you went to your doctor and said, "Do I have osteoporosis?" how would they decide that? Well, there's 2 ways. First of all, you can have a bone mineral density scan. You've probably heard it called just a bone density. And that we'll talk about in just a minute. I have a whole slide to teach you a little bit more about what that means and what you can expect if you have one coming up. The second way is a fragility fracture. So unfortunately, as I said, osteoporosis is sometimes silent and can kind of sneak up on us. And one of the only ways we find it is if they have a fall from standing height, resulting in a fracture. Okay, and now what is a bone mineral density scan? Well, it's a low energy X-ray, so very low radiation of your spine and hips, usually your lumbar spine or your lower spine, and one hip. It takes about 10 to 20 minutes. It's painless. And the results are scored by a radiologist. And then they're compared using something called a T-score. You might have heard of that from your family physician. They compare your score to the score of a healthy young adult. And it really gives us an idea of where your bone density is and how much it may have changed from when you were younger, and also what your risk of fracturing is. And based on those results, your physician will help you make decisions about treatment. So who should have a bone density scan? Well, women over the age of 65 and men over the age of 70. Or women under the age of 65 and men 50 to 70 years old who have risk factors for fractures. So things like an early fracture in a first-degree relative, or if you have one of the medical conditions we've talked about, if you've been on prednisone, a steroid for more than 3 months at a time, things like that, that would increase your risk of fracture, then it's important to have a bone density scan. Okay, now let's talk about some treatment options. So how can osteoporosis be treated? And in addition to treatment, even if you don't have osteoporosis, some of these ideas can be extremely helpful in preventing osteoporosis. And that's a lot of this, because as we've said, osteoporosis sometimes just sneaks up on us, and we find out about it because of a fracture. So it's important to help prevent osteoporosis from developing. So we're going to talk about a threefold approach. First of all, exercise and falls prevention. Second, calcium and vitamin D. And third, we'll just basically touch on medication. Okay, so exercise. Osteoporosis Canada, you've heard me talk about them a few times. They have this great workbook called Too Fit to Fracture. A lot of you are actually already familiar with so many of these topics because of your cardiac rehab, but a lot of them can be applied and just tailored a little bit if you need some bone health improvement as well. So we're going to talk about strength training, balance and posture training, and aerobic physical activity. Okay, first of all, strength training. Why is strength training important? Well, I don't know if any of you have seen, I'm sure some of you have, the videos of the astronauts in kind of the early days coming back from the International Space Station. And there were these big, strong people who've trained their whole lives to be an astronaut, and then they come back to the Earth where there's gravity, and they just crumple, and the people have to carry them back to the hospital to be worked up and see what's going on. And a lot of that, there's been new research that's come out and has showed that the more when you're in an anti-gravity environment, which means you don't have the Earth's weight pulling on you, your bones get weaker and your muscles get weaker. And so we use that to help justify the fact that strength training to strengthen our muscles, strengthen our bones, can actually help to prevent our bones and muscles from becoming weaker. Okay, so strength training, I know you've done some resistance training in your cardiovascular rehab. Osteoporosis Canada has some examples here of squatting, wall push-ups, seated rows, but really it's anything where you're moving a weight against gravity. You can use bands, you can use free weights, you can use a bag of flour, really whatever you have to try to do some resistance training. And again, I'll point you back to your cardiac rehab supervisors that you've had in the past and your exercise prescription, because a lot of you already have great examples of what you should be working on. Okay, next, balance and posture. This is something that you should be doing every day. So balance exercises like Tai Chi, chair yoga, dancing and walking on your tiptoes or heels in a safe environment to make sure you're not going to have a fall. As well as posture awareness. So really trying to roll your shoulders back, walking up straight, not gazing at the floor, things like that to try to help your posture and balance to prevent falls. And then lastly, aerobic physical activity. And I know you're all experts on this, so at least 150 minutes per week of aerobic physical activity as cardiac rehab patients and people who've gone through the program before. It's important to listen to what your cardiac rehab supervisor has prescribed you. And so if you haven't done rehab in a while, go back to those prescriptions and see what type of exercises they were recommending you do and how fast they were recommending you do it. The general approach is at least 150 minutes per week in bouts of at least 10 to 20 minutes at a moderate to vigorous physical activity level, which means that you can talk while you're doing it, but you couldn't sing. Examples would be walking, biking, aerobic classes, whatever you like to do. I will just make a note quickly about aquafit and swimming. They are excellent physical activity as options, especially for aerobics. However, the only downside is if you're doing it specifically for bone health, is if you remember about my astronaut story a little while ago, the pool puts you in kind of a semi-anti-gravity situation. And so activity in the pool won't have quite as much of a benefit on your bone health as it will on other things like your cardiovascular health. So just something to be mindful. Okay, a few more slides here. So calcium, why is calcium important? Well, calcium, as we said, is one of the main minerals that makes our bones hard, and it's one of our bone building blocks. So adults age 50 and older should have about 1,200 milligrams of elemental calcium per day. If you can get this through your diet, through things like dairy or soy milk, that is definitely preferred to taking an oral supplement. If you can't quite reach the 1200 milligrams per day of elemental calcium, then you can go to the drugstore and purchase a calcium supplement. But we'd really encourage you to talk to your doctor and use one of the online calcium calculators to see how much calcium you're actually receiving in your diet every day. Vitamin D is the other really important vitamin that I will talk about today. Vitamin D helps our bodies absorb calcium from our food and supplements. It's made in our skin when the sun interacts with our skin. And because we live in Canada with a long winter and a lot of time spent inside, often Canadians specifically, or people kind of in the northern hemisphere, don't have enough sun and don't have enough vitamin D. Of course, when you're exposing your skin to the sun, you want to apply sun protection, but specifically when we're talking about vitamin D, sometimes we need a little bit of a boost. So what we mean by that is usually we recommend people take about 1,000 to 2,000 international units per day of vitamin D. However, we really recommend that you talk to your family doctor or your nurse practitioner about having your vitamin D level checked so we know where you're starting and what the proper amount of vitamin D is for you to be taking. Okay, so lastly, we're going to touch a little bit on medications for osteoporosis. There's 4 main types of medications. Some of you may already be on them. There's the first class is called bisphosphonates. It helps to make our bones very strong and really last quite a long time in the system. People usually take them either every day, once a week, or once a month, depending on the medication that they're taking. These medications, of course, have side effects, so we recommend that you speak with your physician about what's right for you if you do need an osteoporosis medication. Additionally, there's some that are injection form, like denosumab. It's also called Prolia. Some people are on this and they take it every 6 months via injection. It's only available to certain people with certain medical conditions. The same thing with teriparatide or Forteo. However, if you're on either one of these medications already and you've missed a dose, we'd really recommend that you go and speak with your doctor, because even a few months or even 1 month of a missed medication, specifically of these ones for bone health, can be detrimental to your bone health. So speak with your physician if you're interested in these medications because you've been diagnosed with osteoporosis, or if you just want some more information. Okay. All right, let's wrap up. Thanks so much for joining me. I just have a few key points and take-home messages for you. First of all, bone health is an important part of your overall health, especially as women age and go through menopause and their bone health starts deteriorating. It should become even more important to start incorporating some of these kind of healthy ideas into your daily routines. A healthy nutrition schedule, exercise, and falls prevention are very important for bone health. Some people may need medications to help maintain their bone health despite doing everything that we've talked about today, and that's okay. You can speak with your doctor more if you have any specific questions about medications, or if you think you need a bone density or vitamin D test. I just have 2 resources to leave you with. One is called Osteoporosis Canada, their website. It has the calcium calculator that I mentioned. It also has some more resources about osteoporosis, about bone health. They're really great resources for you to go and do some more homework with. Additionally, Room Info has some very good summary information about bone density scans, as well as osteoporosis and treatment options. Thanks so much for listening today. And now we'll just move into our question and answer period.
Wonderful. Thank you so much, Dr. Daly. That was wonderful. Okay, so I actually have a question while others are thinking about any questions that they may have and typing them in. So you spoke quite a bit about prevention of osteoporosis. I'm wondering if you can reverse the effects of osteoporosis. So once you've reached a certain point, can you do things to reverse that and to improve your bone health, or can you just prevent it from getting any worse?
That's a great question. So there, in terms of bone strengthening, we do think from a medication standpoint, there's one medication called Forteo, which we do actually think has some bone building effects, but the other medications more so just kind of keep you where your bone density was. In terms of strengthening your bones, absolutely in the early years as you're building that bone mass, it's really important to be doing resistance training, having enough calcium and vitamin D in your diet. And then as you've kind of come over that curve, to try to kind of flatten it out. You wouldn't typically be able to kind of rebuild your bone, but to be able to flatten it out and kind of stop it in its tracks. And resistance training, as well as the dietary changes and having enough intake, not smoking and alcohol, will definitely take you from a trajectory of kind of going down to being able to kind of flatten out. And to some extent, there may definitely be a little bit of bone building with exercise specifically, but I'd have to look into that a little bit more. But from a medication standpoint, there's one medication called Forteo, which is thought to build bones a little bit. It's really important in your bone building phase when you're really increasing that mass to be doing things. I know for a lot of people, they're kind of post that. So it's really about kind of stopping the osteoporosis from getting to a point where you're having fractures.
That's great. Thank you. Looks like we have a couple of questions in the Q&A there, so I'll let you take a look at those.
Okay. Okay, so there is a great question about how long is it safe to take the medications and then what? So this is a great question. We often, with the bisphosphonates, if any of you are on them, may have heard of what should be called a drug holiday. And with these medications, we generally, it depends on your doctor, would say about anywhere from kind of 10 to 15 years on those medications. And this is because once you've been on the medications for a long time, your risk of something called an atypical femur fracture increases. And so I'd really encourage you, if you are on one of those medications and you've been on it for 7, 8 years, to talk to your family doctor about other medications that may be an option for you. The thing with those medications is they stay in the bones for a very long time. And so actually taking a break for a year or however long your physician feels it should be is actually relatively safe in terms of your fracture risk. Okay. And then I have another question here. Is taking a calcium supplement problematic in relation to developing plaque in blood vessels? That's a great question. And actually there's been 2 recent studies looking at calcium supplementation and cardiovascular health, especially in women and other people and men with cardiovascular issues. And so Osteoporosis Canada, which is the body, as I said, that kind of oversees guidelines, and some of the leading osteoporosis specialists in Canada have looked at the evidence. And what they have come together and said is, you know what, calcium is controversial. If you can get it through your diet, that is the preferred way to do it. Taking a calcium supplement, usually they recommend specifically for women with cardiovascular health issues to not take more than 1 pill of calcium supplement. So that's about 500 milligrams of calcium carbonate, which gives you about 300 milligrams of elemental calcium. So I'd really encourage you to speak with your family doctor about what is the right amount of calcium for you. Historically, 15, 20 years ago, we'd say everybody should be taking calcium all the time and they should take lots of it. But now there's been some changes in the evidence and in the guidelines, and we're actually saying, you know what, 1,200 milligrams of elemental calcium is enough, and you might be able to get that all through your diet. And if you can, that's definitely the preferable way to do it. And so again, I'd say speak with your doctor, and you can discuss some of these questions in terms of calcium and specific to your situation with your heart, because not all heart diseases are related to the plaque. Okay, great. And just looking at this last, okay, I have another question. How much dairy would you need to take to avoid supplements? Very good question. So, and even for those of you who don't eat dairy, so 1,200 milligrams of calcium is quite a lot, but the best way to do it is to actually look at the nutrition panel on the side of your foods and look at how much calcium is in things. In 1 cup of milk, there is 240 milligrams of elemental calcium. in about a cup of yogurt, there's about, in one of the small yogurts, I think they're 100 milliliters or so, there's about 100 milligrams of calcium. And so you can see you'd have to actually have quite a lot of dairy in your diet to eat just dairy. But it's not just dairy that has calcium. There's other foods. Tofu is a great source of calcium. You do have to eat quite a good amount of it, but it's tofu, fish with bones like sardines and salmon in the can. There's also some things that are fortified with calcium. There's orange juice that's fortified with calcium, soy and almond milk, as well as coconut milk if it's been fortified, and some of the other kind of dairy supplements or dairy alternatives like coconut yogurt. Those things can have excellent amounts of calcium. Additionally, things like nuts and seeds can have a lot of calcium. So if you have more questions about that, the Osteoporosis Canada website has a great calcium calculator. So you can plug in how old you are and your gender, and then you can plug in how much of different foods you're eating, and it'll tell you how much calcium you're getting. So that can be really helpful for you to gauge how much you'd need from a supplement.
I'm just gonna duck in here quickly and say another resource you can go to is if you go to our Women with Heart website, where you likely logged in today, and scroll back, our dietitians, Veronica and Fatim and Sam, did a presentation about nutrition for women over 50, and they talked quite a bit about calcium. And so you can look back at that presentation to get a little more information about that as well.
That's great. Thanks, Lisa. That's awesome. Especially if it's already here, I think that's awesome.
And I will add to that is that we have also Cardiac College in that booklet, Eat Healthy. We have actually charts which tell you about which food contains how much calcium, if somebody is looking for a chart.
Great. Thanks, Dr. Nijwan. Okay, my last question here I have about what about calcium and magnesium combos? Again, I would say talk to your physician. It depends on why you're taking the magnesium, and also sometimes calcium can cause a bit of constipation. Magnesium can cause a bit of diarrhea, so sometimes the companies try to put them together. But I would really look at why you're taking the calcium and why you're taking the magnesium and decide if you need both, and that can sometimes be helped. That decision can be made better when you talk with your physician about it.
So before we close, I will announce that in 2 weeks, so Tuesday, August 25th at 10 a.m., we're very lucky to have Dr. Paul O, who is our medical director here at Toronto Rehab, presenting, and he's going to talk about everything you need to know about high blood pressure in women. So please tune in for that and bring all your questions, because Dr. O will be more than happy to answer any questions that you may have. And so we're very much looking forward to that. So without further ado, I would like to thank Dr. Daly for your wonderful presentation today, and everybody for signing in today. And have a wonderful couple of weeks, and we will see you in 2 weeks.